Hi, this is Victoria Smart, and today I will be performing a collection of urine through a stream. First thing I'm going to do is verify the provider's orders. I'm going to gather my necessary equipment and supplies. I'm going to provide patient privacy and perform my hand hygiene. Then I'm going to introduce myself to the patient and their family if present. I'm going to identify the patient using two identifiers, asking them their full name and date of birth, and checking that on their wristband. Next, I'm going to explain the procedure or what we will be doing and making sure that I gain consent. And then, if the patient is independently able to collect the urine sample, I will first explain how to perform and have the patient perform hand hygiene. I'm going to provide the specimen container or cup, graduated measuring device that we will be gathering the specimen in. Then I'm going to ensure that I have aseptic towelettes or wipes for the patient to use to clean and cleanse their perineal area. And then I'm going to always also make sure that the specimen container and the wipes are within reach of the patient while using the facilities. For a male patient, I'm going to hold the penis with one hand, my non dominant hand, asking them to retract the foreskin to properly clean the meatus, and then taking the cleansing towelette, working from the outward to the center outwards, cleaning the meatus and the tip of the penis. And then I'm going to have them initiate a urine stream, hand them the specimen container, and have them collect the necessary volume of urine that we will be examining. After that, I'm going to remove the specimen container before the flow stops and before releasing the head or the foreskin of the penis. And then when they are finished voiding, I'm going to make sure that I close the aseptic container, making sure I only touch the outside of the lid. And I'm going to put the patient's label on the outside of the side of the container, not on top of the lid. For a female, I'm going to have her spread her labia minora with her index finger and her thumb. I'm going to provide her with a cleansing towelette and ask her to clean each side, working from front to back, both sides, and then down the middle. I'm going to ask her to initiate a urine stream and then hand her the specimen container. Making sure that she gets the proper amount of volume in the cup before releasing the labia majora and removing the cup before the stream has ended. If the same thing, I'm going to close the container and label the outside side area of the specimen container. If the patient is or when the patient returns the sample to me, and then I'm going to immediately transport the specimen to the lab. If the specimen is not going to be directly examined, make sure that it is refrigerated and protected. And then I'm going to discard all my supplies, remove my gloves, and have myself as well as the patient perform hand hygiene. If the patient is immobile, I'm going to perform my hand hygiene, don gloves, gown, a mask, eyewear, or a protective shield if necessary. I'm going to assist the patient onto a bedpan and raise the head of the bed into a sitting or semi-Fowler's position. Using aseptic techniques, I'm going to open the sterile specimen kit or container. I'm going to place the cap with the side up. making sure that the sterile side is face up, avoiding contact with the underside of the cap. And then for a same thing for a male patient, like I said before, if they need help cleaning their perineal area, I will do that. Have them urinate between 90 to 120 milliliters into the specimen cup. And then, like I said before, the same thing goes for the female. Help her clean her peritoneal area, cleanse like all the urethral area, moving from forward, backward, towards the anus, making sure that a fresh wipe on a female and male is used every single time. And then depending on policy, some agencies want you to rinse the area with sterile water. So if that is necessary, I will do that. And then lastly, I'm going to replace the cap on all the specimens, send them straight to the lab. Before I will help the patient off of a bedpan and empty the bedpan, record the amount that is discarded and the amount collected if the patient did output anything. I'm going to securely attach the label to the side of the container, making sure it's not the lid. And then if it is a woman, I'm going to want to note whether she is on her period or menstruating at the time of the specimen collection. I'm going to prepare it for transport and place it in a biohazard bag with the proper labeling for the lab. And then I am going to discard all my used supplies, remove all my PPE, and perform my hand hygiene, making sure that the patient is in a comfortable position. They have as well performed hand hygiene, and they know how to use and are aware of where their call light is at, making sure all their personal belongings are within reach. Raise the side of the bed that I was working on, and lower the bed all the way down to its lowest position, making sure that the wheels are locked. And lastly, I'm going to document and report the patient's response and expected or unexpected outcomes of the output that was given.